you have a joint pain, you need to listen to this video because regenerative medicine has a lot to offer as far as viable long-term relief. So when you typically have joint pain, and I'm talking elbows, shoulders, knees, etc., even in the back, the common thing to do is to go to the doctor and get a prescription medication for an anti-inflammatory, maybe get some physical therapy to get rid of that joint pain, and eventually that's going to lead into doing things like steroid injections and then eventually surgery. That's the standard, the gold standard of medical care for joint pain follows that over-the-counter anti-inflammatory, prescription anti-inflammatory therapy, injections, surgery. Regenerative medicine is a viable alternative to that quote-unquote gold standard. What regenerative medicine is taking your body and stimulating your own body's ability to heal itself so that it can actually start to regrow new cartilage to help get rid of pain, get rid of inflammation, and actually getting a better functioning joint. There's actually options in regenerative medicine, the first one being low-level laser therapy or cold laser therapy. If you look at the thousands of studies that are behind this, basically what it does is it stimulates cells to produce more energy so they get more blood flow. This helps with the inflammation. There's also an effect on cytokines and growth factors, which are chemical signals to your body to heal itself. The next thing on the line is PRP, or platelet-rich plasma. Manuals of research have been done behind platelet-rich plasma. The process is actually fairly simple. We take blood from you, we spin your blood down in a centrifuge, and then take the yellow plasma that's left up on top, and we re-inject that back into joints. What this does, it concentrates your body's own healing powers back into that joint and helps the body to heal. The problem with PRP is it is age dependent. The older you are, the less likely it is to work because you're taking old material from yourself. The last form of regenerative medicine is actually the use of stem cell products, where we take natural live births from here in the United States. We actually take their umbilical cords, their placenta, and we can use the products from those materials to produce other materials that will actually help your body stimulate an even stronger response. The value here is that it's not as age dependent as PRP is, because you're taking those chemical signals that come from a newborn's stem cells. Those stem cells are going to release its own material to signal the body to grow as fast as it can. You can take those signal molecules and put them into a joint. They will get that same signal telling that body to regenerate and regrow itself. So that's where we see the fastest response. There's not as much age dependency there. But the thing to do is to actually sit down and let's talk about what's going to work best for you, what's going to give you your best chance for success, and come up with a plan together to help you get back to where you want to be.